Hey everybody, and thanks for tuning in. My name is Robert Metzke, and I'm the Global Head of Sustainability at Philips. Let me just start by saying, in today's session, we want your input. So please ask all the questions in the comments, and we will try to answer some of them at least at the end of the session. Today, we want to talk about environmental sustainability in healthcare organizations. There's an established link between human health and planetary health. Did you know, for instance, that about 16% of global deaths are due to environmental pollution? At the same time, our hospitals belong to the highest energy intensity buildings that we have of publicly funded buildings, and they emit about 2.5 points more greenhouse gases than other commercial buildings. And also material streams and waste are huge in healthcare. Did you know that in the US healthcare system, for instance, waste amounted to 750 billion last year? This really has to change. So we want to outline today the relationship between healthcare and climate and how we can address this with urgency in our organizations. And we want to talk about the link between human health and planetary health. So before that, of course, we really want to have also your input and get a better understanding of what drives your passion about sustainability in healthcare. I have the pleasure today to be joined by one of my favorite colleagues, Olesya Struk. Hi, Olesya. Can you please introduce yourself briefly?
Sure. Hi, Robert, and thank you. It's great to be speaking in details about this topic today. I'm a Senior Director in Group Sustainability at Philips, and in my role, I have a pleasure to be working with customers and partners on sustainability topics around the globe. I'm also a business partner in sustainability to precision diagnostics business, and I'm leading Access to Care program that helps improve access to the underserved communities with solutions of Philips and partners. By the way, Robert, did you know this fun fact that together we have been working in Philips in total of about 20 years?
I didn't realize. It has been that long already. Time flies when you're having fun, Olesya.
Indeed, that's right. So perhaps to start it off, Robert, could you outline which role does the healthcare organization play in today's climate action debate?
Yeah, I think that's an important question. Thanks. It's important to address the urgency for change in the healthcare sector, because while climate change on one hand is really impacting healthcare, as I said earlier, healthcare is also really impacting climate change and the environment. Looking at our audience, I can also really imagine that many of the healthcare professionals listening today must see unsustainable practices in day-to-day basis. Think just about the amount of waste from single-use devices. A few people will realize that the healthcare systems globally the emissions from healthcare systems amount to more than 4% of global CO2 emissions. That's more than airlines or shipping. So making healthcare industry more sustainable will involve many forms of action, including intelligent use of low carbon technologies, I can imagine, the greater use of telemedicine, digitalization, as we have seen also during the COVID crisis. And at Philips, we really try also to help our customers to reduce their own footprint, for instance, through investing in eco-design and energy efficiency in operations. This also means that we try to give our partners and customers better insights in the environmental footprint of their own supply chain. And perhaps some of the people that have joined us today rely on these types of metrics and disclosure already to get a better grip on their own environmental footprint. And we would like to hear from you. Olesya.
Yeah, indeed, Robert. And also, I think you mentioned it briefly, healthcare has had a challenging year at the same time. And also the current state of affairs is saddening. However, COVID-19 also reignited the urgency to have a global call to build more robust, resilient health systems and societies that can also respond to such a crisis. So it has also triggered the boost of innovations, as you mentioned, in the digital connected care, for example. So it also proves that it's possible to have coordinated and comprehensive response to a big ask, right? And we need to team up on it across organizations, like on the environmental footprint. What do you think, Robert?
Yeah, I would agree. COVID has put a magnifying glass on many on the challenges, and we see that they are interconnected, and not a single organization, government, or company is big enough or should try to solve it all alone. So we really need to team up. So if you look, for instance, the focus of climate action and reducing CO2 emissions, we also need to focus on reducing waste, on circular economy and eco-design our products. And of course, you need to do that with customers and the environment in mind. So global research clearly also shows that companies or countries or organizations that have an active long-term strategy when it comes to global warming will be economically and financially better off than others. In other words, more sustainable. So how do you see partnerships taking form in your day-to-day work, Olesya?
Yeah, that's a good question. So we team up with our partners, our customers and suppliers to deliver sustainable value and also to drive global change. Yeah? And I cannot say that it's an easy task. However, there's great, huge energy in this joint effort when we do it together. In general, in the hospital, sustainability entails multiple streams, like you mentioned: clean energy, green and responsible procurement, green building, waste management, etc. But organizations need to go deeper on each level and try to connect the dots across them so that each professional and each organization can do their best for a collective output. One recent example especially strikes me. It's a doctor in one of the medical centers in the Netherlands, anesthesiologist, and he described how he is making the choice of use of anesthesia gas by, of course, taking care of the best care for the patient, but also taking care of CO2 footprint, because it's possible to reduce a CO2 footprint without compromising also the question in the care that is being delivered.
I think that's actually a great example, Olesya. It really shows that it starts with awareness. And I believe it also shows that healthcare professionals, including some of our viewers themselves, really can challenge suppliers when they believe things could be done better. Now, you gave a very specific example with the anesthesiologist in the Dutch hospital. Maybe there are some other examples of larger systemic changes as well?
Yeah, indeed, that's a great question, Robert. So an example of largest systematic change is that we have started to fundamentally redesign our business models together with our customers. Example project, recently we team up with several of our customers in the United States, with several industry partners as well as NGO organization, to start the project on market transformation about the move to the circular economy in healthcare. And in that project, we have outlined also recommendation both for the healthcare provider and also to the suppliers, to the industry partners about that. So healthcare providers have a large footprint and have a large facilities with medical equipment, for example. And it also substantial material use and also substantial CO2 footprint that is generated by the energy consumption of those. But when there's a need for the next medical equipment purchase, etc., it's a good thing to do is to look at the overall installed base, what's available, what is the patient flow, which is currently there, to think about also the next clinical requirements that will be there, and to formulate what kind of solution is required going forward. And then during the purchase procurement process, to include specific circular requirements to such a solution, to equipment or service. For example, upgradability, remote serviceability. For example, energy monitoring of the energy consumption. It's also responsible manufacturing, use, and the follow-through of that solution until the end of life and harvesting, following it back to the manufacturing in order for not to waste, not to use those materials later, but harvest them and include it into the manufacturing again. But also for the industry organizations, recommendations are start with rethinking how we design our products and solutions. Thinking about modularity, connected and digital technology as part of this, again, remote serviceability, but also interoperability with other elements, and responsible follow-through to close the loop on the specific item while thinking about the best input for the good quality of care and the lower cost with great experience for patients and for healthcare practitioner. So it's an example, quadruple aim that I mentioned. So yeah, that's just an example how together by joining forces, we can indeed connect the dots of the circular economy and close the loop, but also make a shift in the market, in the industry like healthcare, which is pretty significant industry if you think also globally, and therefore can have a great impact on environmental costs. Robert, what do you think?
Yeah, great to hear that, Olesya. And it keeps fascinating me how to see these new ways of thinking in healthcare organizations, also to really address also the environmental footprint and combine that with the highest standards of care. I've seen quite an increasing number of hospitals around the globe that is really running, or at least started piloting also sustainability programs, right? We know that there are hundreds, if not thousands, of hospitals have pledged to become carbon neutral. And maybe another example of a big customer from us, a leading healthcare provider in the United States, is working very hard specifically on carbon neutral. Let me maybe just give one specific example also on the material side, where a single MRI scanner that we provided really has a significant effect. So the product itself is completely refurbished, meaning that it's a pre-owned system that has been thoroughly updated and fully quality tested. When we then lease this to healthcare providers, we provide a solution instead of just owning a product. So that makes it different, also lowering the entry cost. And then through digital technologies and our software, we can further optimize the usage of the MR constantly, extending the lifespan, increasing uptime, and so forth. So when we take back the equipment in the end, when it's no longer needed, we can refurbish and maybe harvest even components to further extend the lifetime of precious materials. So I think in the existing refurbished medical equipment clearly can demonstrate that right business decisions also need to be the right choice for our planet and society, and also helps to make healthcare accessible and keep it affordable. So we just shared some examples of teaming up to realize better environmental and social impact. But I can imagine that many people watching right now are still looking for ways that they can contribute, so that you can contribute. So if you have questions, please do post them in the conversation of this live session. Do you already have any specific advice for now that you could give, Olesya?
Sure, and I would like to say that there are many ways to get involved. And if I put it in simple words, first, let's get aware, let's share the message, have a clear intention, and join a collaborative group. For example, at Philips, we are keen to partner with like-minded organizations, and we are sitting in several coalitions for that. And also, we are working closely with a great organization, Healthcare Without Harm. It's the NGO, which is both in the United States and Europe, and it's driving the thought leadership on the topic. There are great publications on their sites and materials, and also events coming up. And the drive is for the transformation, indeed, in the healthcare for a better environmental footprint. But also in Europe, the great conference is coming up. It's a Clean Med Europe in the end of November, where we'll be talking about leadership in the healthcare, also with improving environmental footprint. And we will mention the circular economy a bit more details. These are some examples, Robert.
Yeah, that's a great example. Thanks, Olesya. And the triggers another one, for instance, PACE, where we are also quite actively involved, the platform to accelerate the circular economy. We actually have a lot of publications that are really relevant for health professionals, including Plastic Policy Playbook and many others, committed to driving a very concrete agenda of adopting circular best practices across many different industries. So we will share the URL also in the comments so that you can look them up and engage and see whether that's also relevant and meaningful for you. Olesya?
Yeah, I also would like to mention that doing business in a sustainable, responsible way, we work on other organizations on environmental footprint, but also there is the social dimension. For example, it's the improving access to healthcare, which is so important and vital, and right now is very evident as well. But also thinking of the underserved communities, we are teaming up with our, again, customers and partners to design the solutions that can improve access in the underserved communities. So just wanted to mention that, since it's also important part of sustainable and responsible doing business. Yeah.
Thanks, Olesya. I think that's a critical point. Healthcare professionals caring about people, making healthcare and keeping healthcare accessible is, of course, close to our heart. And while trying to make sure that healthcare does not further harm the planet, of course, the heart goes out to the patients. So making the economy more circular, but also more inclusive, and making healthcare accessible is definitely very important. Nice to see that through some of the partnerships and customer examples we've touched already, we are really also optimizing our own operations. For instance, at the end of this year, we are reaching an important landmark and goal. We will be operating carbon neutral at Philips globally. To me, this just shows again that we cannot do this alone, but we really need to team up and move together. Well, having said that, maybe let's have a look first look at the questions that are coming in, shall we?
Great. Let's see.
Yeah, so I see a question here from Tila Kamara, and excuse me if I mispronounce your name. How have you designed your products and partnerships to ensure climate action? And how is the reception so far? Maybe you want to take a first shot at that, Olesya, and me adding to that?
Sure. So in our product and solution design requirements, we have our green requirements that make sure that also energy consumption and packaging and also other elements of the producing the product solution, but also the use stage, because the use stage has the largest impact on the carbon footprint. That we improve it with every next solution, and we make sure that we are using the best practice from the competitors, and we improve on it all together. This is an example how we can design it better. And I think the second part of question was, do you want to take that one?
Reception. Yeah, the reception maybe. I can also come back to that indeed. Maybe let me add to that. We are committed to science-based targets, 1.5 degrees, and that really we take that very serious, including our own operations supply, but also the use phase. A lot of the impact of our products is in the use phase because they simply use electricity. That's why we drive eco-design consistently since many years by now. With the new program that we just launched, we strive to eco-design every single product from Philips globally to adhere to these standards. And that makes a difference. So we've issued also, for instance, the Green Impact Bond to raise 750 million euros last year alone to invest in these programs. So it's a significant part of what we do in terms of R&D at Philips. Yeah, reception so far. I think, we just received yesterday recognition again from the Wall Street Journal.
That's right.
Right. They looked at 5,500 companies globally and nominated us as the second most sustainable company in the world. So, of course, I encourage you to look up who is number one, but I think that's a fantastic recognition for these efforts. Maybe let's have a look at question number 2 from Durga. In general, what is the impact of a global supply chain on environmental footprint, and how is this in relation to COVID? Maybe I take a first shot at that. I already said, so what we do is we really look end to end and what our environmental impact is, for instance, by doing life cycle assessments. And then we publish an environmental profit and loss statement. So if you look at the Philips annual report, you see exactly where our environmental footprint is. What you will find there is that the impact of our supply chain is about a factor 10 bigger than the impact of our own operations. So it's significant. And we have between 10 and 50,000 suppliers, and we work very closely with them to reduce the environmental footprint in the entire supply chain. So they are part of, for instance, our commitment to science-based targets. And we have really strong programs, not just to drive transparency in the supply chain, but also to invest in capabilities of our suppliers, help them strengthen their own processes, and improve the living and working conditions of suppliers in our supply chain. Anything that you want to add, Olesya, that I forgot?
Indeed, maybe one more addition that the COVID-19 situation also reconfirmed that we need to build resilient health systems, which means we need to have the solutions that are here first sustainable, meaning that they deliver immediate value, but also long-term value that can be adaptable as we go along and different needs in public health evolve. And therefore technology collaboration, but also collaboration across the supply chain so that it's modular, it's flexible. Also, the specific cross-border discussions and negotiation can take place faster while we are taking care of our planet, because it's also an important factor of our healthcare going forward.
Yeah, very important addition. Thank you, Olesya. Especially with critical supplies for healthcare providers, including patient monitors or ventilators that are really in high demand in the COVID situation. You want to make sure that you have resilient supply chains, and you don't. To have resilient supply chains, you need to invest in the relationships, of course, and that is part and parcel of our supply development program. Now we have another question that's coming in. Let me read that. In Africa, we may not have the financial muscle to keep buying products that have now been made environmentally friendly. How can we make our existing equipment climate friendly?
Yeah, it's a great question.
Yeah.
Maybe I can start with the first comment suggestion. I think absolutely great, valid question. On the short term, so then probably the idea is about the retrofit or how we can improve or, if possible, upgrade or enhance existing equipment and materials. It's also about the use phase of the equipment, how it's applied, how is the scheduling done, then some potential improvements possible. But also, again, thinking about the building that health system and the elements of health system that is resilient, interoperable, and that also be building blocks for a longer term, which includes also education, which includes seeing through how that equipment or other equipment can be combined together and going forward. So just maybe a couple of starting thoughts.
Thanks, Olesya. You are, of course, also leading our global access to healthcare program, which is another part of your responsibility. So I imagine that is close to your heart, that question. And I really that combines both the social and the environmental impact. So two other thoughts that came to my mind is refurbishing equipment is one way to also make them accessible and being able to make them affordable at a lower price point. And then moving to access-based models and moving away from selling equipment to selling services can be an important part to also make latest technology available and moving from, let's say, CapEx-heavy models where you have to have a high burden of upfront investments to more OpEx and service-oriented models that may be specifically interesting to markets with lower spend. There's a question from Swanadesh Kulkarni. How are you working on use of plastics in medical device that won't harm the environment? So yeah, I think the underlying question is really what do we do about the not just the environmental footprint and the material side of our medical equipment. Olesya, you want to take a first shot at that?
Sure, I think indeed that's not an easy question, and we're quite open also for discussion and collaboration on this one. So the first, we are including the material requirements and material basically descriptions in the whole product design phase. So that's important. And then also we follow through the product and solution with that and follow it till the end of life. And then we would like to harvest it and see which part can be reused, upgraded, recycled, reprocessed, and moved back. And our teams are working quite hard on the questions also of the plastic, but of course in the medical equipment that's a very good project that we are working on.
Yeah, so what we typically do is also develop technology and material roadmaps for the years ahead, and then make, for instance, also commitments to our suppliers about the use of recycled plastics where possible and appropriate. But also really looking at the impact of material choices in terms of environmental impact. That's why we do these life cycle assessments, LCAs. And as Olesya said also, it's not just a product or material property, it's also how you bring your products and solutions in the market and how you take them back. That's why the circular economy program is so important here. Yes, Do we have another question? Let's have a look. Question number 5.
Oh, great. I think one of your favorite questions, Robert. Shall I read it out for
Yeah,
you?
please do.
Do you measure your own improvements in sustainability?
Yeah, we do, actually. Indeed, it's a great question. So we do have financial and non-financial performance indicators at Philips, starting with a target to improve 2.5 billion people's lives or 2 billion people's lives in 2025. And then we cascade that down throughout the company. So we have a performance management cycle where we set environmental and social impact metrics, and they go into indeed how we innovate, how we drive operations, how we interact with markets and customers. And we are very transparent about it. So we publish every year an integrated annual report that covers both financial performance of Philips, but also the environmental and social performance, and that is fully audited. So if that's of interest to you, we'll find it on the internet. So yeah, measuring is a good way to know what you're doing, and enables, of course, to steer and drive improvement. Critical. Olesya, you want to add anything?
Just would like to mention that also in the measurement, reporting, and in the joint sharing the data and insights, that's where also the additional development, the additional improvement is coming in. Once we can start more and more with our customers and partners, measure the indicators and environmental footprint in a similar way or in the same way, then we can collaborate much better and much more efficient on the solution end to end. So there's another angle of this question as well.
Yeah, that's great. Thanks for that. I think there's a specific question on the interest of customers in opting in for refurbishment. Do you want to say anything on that? So how are customers interested in refurbishment?
Yeah, I think it's a great question. So in fact, so also in the healthcare, in the medical equipment, we have high demand for refurbished systems, and it's around the globe, and both developed and developing markets. And often these are customers that indeed want the best solutions at the price level that they would like to have, but that delivers all the needs that they have at the moment. And I should say that it's sometimes it's also supply side that needs to be strengthened, so that the customers also allow us to harvest the systems that are no longer in use, so that we can put it in our supply chain and produce more refurbished equipment, and then can help serve the other customers. So refurbishment is also something that is close to my heart, something that I really like, that model, because refurbishment is good as long as it also serves the customer on those needs. And by the way, we also do the same certification, quality requirements, etc., that is needed, so the quality is not compromised.
Yep,
so I hope that answered the question.
Yeah, thanks, Olesya. Important. We are approaching the half hour, so maybe one last question. Olesya, where lies the most room for improvement in healthcare? What's your perspective on that?
Yeah, I believe that we are still at the beginning of this. While there are many organizations and healthcare organizations done amazing jobs, some healthcare organizations announced that they are carbon neutral, so it's like double thumbs up. However, it's exactly by connecting the dots. What are the public health needs? How the healthcare system needs to develop, and so that we take care of those material usage, CO2 footprints all together, and do multiple improvements while keeping the patient at the center of it. So that's why I'm so excited about our partnership and the coalition work to start unpeeling the next level of this question. What do you think?
Yeah, that's very clear. I think thanks for stressing again the importance of partnerships. The thing that I would add is I think it's really important to start with understanding where the material impact is of your organization, be it a hospital, be it a supplier, and however you are related to healthcare systems. So understanding on where do you have an impact, and then making it strategic and not having this only refined to environmental specialists or operations. Really discuss this at the boardroom and develop a roadmap going forward and communicate about it with your stakeholders, and do ask for help and make clear what you expect from others. So maybe and use the resources that we also published in the chat. With 30 seconds to go, I just want to thank you all for your great questions. Thanks to Olesya also. It was a wonderful conversation. I hope that we triggered some new thinking and gave you some ideas on how to progress. Please stay tuned, look at the materials that we provided, and looking forward to seeing you soon again. Thanks so much. Bye for now.
Thank you, Robert. Thank you, everyone.